What should be done if a patient becomes unresponsive in ICU? Check for pulse and breathing. Activate code blue, start CPR, and inform the doctor immediately. What is the function of pulse oximeter? Pulse oximeter measures pulse rate and oxygen saturation non-invasively. What is sepsis and how do you identify it? Sepsis is a life-threatening infection causing systemic inflammation. Symptoms include fever, low blood pressure, confusion, and high heart rate. What is Rayleigh tube and how is it used? Rayleigh tube is a nasogastric tube used for feeding, medication, and gastric aspiration. What is the dosage and route of adrenaline in anaphylaxis? 0.5 mg intramuscularly in adults. Repeated every 5 to 10 minutes as needed. What is oxygen saturation and its normal range? Oxygen saturation measures the amount of oxygen in blood. Normal range is 95 to 100%. What are the signs of hypoglycemia? Sweating, shakiness, confusion, irritability, rapid heartbeat, and fainting are the signs of hypoglycemia. What are the complications of Foley catheter if left for a long time? Long-term use of Foley catheter can cause urinary tract infection, UTI, bladder spasms, urethral injury, and formation of bladder stones. What are the infection control practices in ICU? Hand hygiene, PPE usage, sterile procedures, proper waste disposal, and isolation protocols. What are the signs of fluid overload? Swelling, shortness of breath, high blood pressure, crackles in lungs, and raised JVP, jugular venous pressure. What is post-exposure prophylaxis? PEP. PEP is treatment given after exposure to infections like HIV or hepatitis to prevent infection. What is the other name of BP apparatus? Sphygmomanometer, blood pressure monitor, blood pressure gauge, blood pressure machine. Who is the mother of nursing? Florence Nightingale. What is the full form of PPE? Personal protective equipment. What is SpO2 and how is it measured? SpO2 is oxygen saturation of the blood. It is measured using a pulse oximeter. What are the side effects of high dose steroids? Weight gain, high blood pressure, mood changes, increased blood sugar, infections, osteoporosis. What are the precautions to take during blood transfusion? Check blood group compatibility, monitor vitals, check for reactions, use sterile technique. What are high alert medications? High alert medications are medications that have a high risk of causing significant harm if used incorrectly. Example: insulin, heparin, potassium chloride. What is anaphylaxis? Anaphylaxis is a severe life threatening allergic reaction that requires immediate treatment. What is an endotracheal tube used for? Endotracheal tube is used to secure the airway and assist in mechanical ventilation. What is the CPR ratio for adults? 30 compressions, 2 breaths. List a few main routes of drug administration. Oral route, intravenous route, intramuscular route, subcutaneous route, inhalation, topical, sublingual, rectal. What is the normal GCS score for a conscious person? 15. What is Glasgow Coma Scale? Glasgow Coma Scale is a neurological scale used to assess a patient's level of consciousness. It evaluates eye opening E, verbal response V, and motor response M. What are the indications for blood transfusion? Severe anemia, blood loss, surgery, low hemoglobin, bleeding disorders. How to care for a patient on mechanical ventilation. Monitor vitals, suctioning airway, prevent ventilator associated pneumonia, ensure proper sedation, assess cuff pressure.